I'm Amy Gelfand, and I direct the pediatric headache program at UCSF. Infant colic, a simple definition, is excessive crying in an otherwise healthy and well-fed baby. But to formalize that a bit more, it's crying for at least 3 hours a day, at least 3 days a week, for at least 3 weeks. It's a lot of crying. And in terms of how common, it affects about 5 to 19% of babies, so it's fairly common. It's not an unusual thing to encounter. When I was first learning about migraine in our headache center, I was really struck by how patients would mention how sensitive to various stimuli they were, like lights and sounds. And it made me start to wonder, because I am a child neurologist and I had done pediatrics training before neurology training, and it made me wonder if that was what was troubling so many of these colicky babies that I had seen while I was a pediatrics resident, whether they were just being fussed by all these stimuli. And so I started to go into the literature, and there were some studies suggesting that children who had migraine were more likely to have had colic when they were babies. And we did a study going a step further and surveying mothers who are coming in to their baby's 2-month well baby checkup, and surveyed whether the mother had migraine herself and whether her baby had colic. Because one of the things with those earlier retrospective studies is that sometimes the parents are being asked to remember what the child was like 9 or 10 years ago, and that can introduce some difficulty or bias. And we wanted to get information based right then. And what we found is that mothers who had migraine were about 2.5 times as likely to have a baby who has colic. And I think what that is that we know migraine is a generally genetic disorder, and so mothers who have migraine, their babies are more likely to inherit genetic genes for migraine, and once they're born, they encounter all these new stimuli out in the world: sounds, touch, smells. And for babies whose brains are wired up to be really sensitive to those stimuli, it's a bit overwhelming, and I think they express that through excessive colicky crying. Overall, it's going to depend a bit on sex, because we know that women, about 18% have migraine, and men, about 6% have migraine once they're adults. So a colicky boy baby is not going to be quite as likely to grow up to have migraine as an adult as a colicky girl baby, just based on the genetics there. I think it's still not exactly clear how likely they are to have migraine when they grow up. If you think that the baby's colicky crying is coming from migraine, essentially, sensitivity to stimuli, then really doing things to try to limit stimuli exposure. Colicky crying tends to happen mostly in the late afternoon or evening, so certainly it's good for babies to be exposed to lots of new things and learn. We don't want them to miss out on their learning opportunities, but maybe do those things when the baby's fresh, like in the morning, in the early part of the day, and then as the day starts to wind down in the later afternoon and the evening, have it be more quiet time at home, where things are kept overall more quiet, not so bright, not too many people visiting, the TV's not on, just keeping things a little bit settled out. When holding the baby, just gently rocking, not being too vigorous in the bouncing. Those types of things I think would be very reasonable. And whether some of the pharmacologic treatments that we use to help children with migraine might help babies with colic really remains to be seen. These are, of course, very young babies, on average 5 or 6 weeks old, so we want to be very careful before exposing them to any kind of prescription medications or even some of our over-the-counter medications. But I think some of them might be reasonable to do in controlled trials to see if we can help those babies not be so fussy. I think several things. One, it's not your fault. It's going to pass. Babies will outgrow colic. It's not going to be like this forever. It's just a period of time to get through, but you will get through it. And the baby's crying is ever really getting to you and you're just starting to feel incredibly frustrated, the best thing to do is just put the baby down in their crib on their back, and it's okay to leave the room. You want to make sure you never lose control and shake the baby, because that can be very dangerous and can hurt the baby's brain. And so if you're getting quite frustrated, it's okay to just leave them in the room and take a breather for a few minutes. But remember, it will definitely pass.